I am so excited for today's call, and I particularly love it when I have the opportunity to be on the phone with you as a physician and an entrepreneur with another physician and entrepreneur, because the conversation is always so multi-layered. But today we're speaking to Dr. Suzanne Steinbaum, who's an expert in women's cardiac health, and it struck me how many of the comments and approaches she takes are similar to how you think about your patients in a much more holistic way.
Well, look, many of us gynecologists really don't know that much about cardiology, and she really simplifies things for us and gives us usable tools to help our patients for sure. Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited to have our guest today, Dr. Suzanne Steinbaum, who wears so many different hats. She's a practicing physician, she's an entrepreneur, she's a change maker, she's a media personality, and we are just so happy to have you here today to really talk about what's becoming a much more prominent, but not any more important conversation about cardiac health and women's health and the intersection and the conversations that historically have not been happening. Welcome.
Thank you. It's amazing that we're actually allowed to talk about this now. People want to hear it, and it's taken a long time to get to this point, and it's just amazing. It's an amazing time for women's health.
So share that journey a little bit when you said it took a long time to get here, in terms of what you were doing before, what you're doing now, and how many different balls you're juggling at the same time.
This journey started for me. I keep saying 20 years, but every year I get older and I'm sticking to 20 right now. But it's been a little bit longer than that, I think. And when I started, I really didn't know what I wanted to do. And I tell the story all the time because it was really my aha moment. I was in the emergency room. 53-year-old woman was being wheeled in. She was nauseous, vomiting, like genuinely sick. And she was evaluated by the team and she was put in the corner with a diagnosis of gastroenteritis. And she proceeded to have a heart attack in our emergency room right in front of us. And I felt the world slow down. I just could not stand it. You know, these were the doctors who were teaching me. I was a student with a wide open mind to learn everything I could. And what I was learning was women are being dismissed and not treated well. And it was mind-blowing for me. And that was it. This is what I wanted to do. I went to the chief of cardiology of the hospital. Actually, I stalked him. That was a whole nother story because he wouldn't meet with me, and I followed him until he finally had no choice. And I said, you know, I want to do a fellowship in women and heart disease. And he's like, well, there's no such thing. And I thought about it for a second. I said, what about preventive cardiology? Because if I could prevent heart disease in women, then we won't have these bad outcomes. And he said, there's no such thing, but let me look into it. And it was just, you know, this magical serendipitous opportunity that he created a preventive cardiology fellowship for me that was CGEMB approved. And I
Explain to people who aren't physicians what that means.
Yeah, it means you've got to go through all the academic documentation and rigor to get this approval. And he went through that process to get it approved on that academic level. So I became a preventive cardiology fellow with a research arm and a clinical arm, and really had metrics that I had to meet to get that accomplished. And so after a year of really doing a deep dive on everything there was to know about cholesterol, what exercise really meant, how diet really impacted us, and stress. I have visions in my mind of people doing yoga on the floor in our cardiac rehab facility way before it was considered cool, I promise you.
You
And
know,
it
it's fascinating to hear this because I think as a whole, we are so reactive in medicine, waiting for
Exactly.
problems to occur rather than trying to address them beforehand. So I'm assuming that's what a preventative cardiologist does, is really address issues before they are issues,
It,
correct?
it's exactly that. And it's also looking at the person holistically. You're not just the heart, you're not just this beating organ. There are arteries from the top of your head to the bottom of your toes. And if you don't address this holistic arterial vascular health, then you're missing the boat. And the other thing that we will talk about, I'm sure, is the connection between all of these different things, especially in women as they show up during menopause. And so entering my career with this holistic approach and really having an accurate sense, even at that time, of the difference between men and women and how it presented and manifested differently, really set me on a 20-year course of running women in heart health programs, not heart disease, heart health programs in
Mhm.
3 hospitals in New York. And during this journey, I became a spokesperson for Go Red for Women, which started 20 years ago. I always say about them, I wasn't exactly invited to be a spokesperson. I just talked a lot and really wanted to spread the word to all women. And 20 years later, I was sitting in a hospital saying 1 in 3 women die of heart disease, more than all cancers combined. And I've been saying that for 20 years and realized either I'm going to stay in the hospital system and be part of the problem, or I was going to leave and
Yeah.
create a solution. I didn't go into medicine, into cardiology to do anything but save women's lives. And that has been my focus and my goal from the beginning.
Fascinating. So, as a gynecologist, I have to say, both the clinicians that I work with, and this is by no fault of their own, and our patients are so frightened of cancer. It's
Yeah.
cancer, 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 screening for cancer, prevention of cancer. Why has the whole heart disease issue, which is so common, not really hit the news feed? Why does this remain such a differential? Because after all, women are not little men. And I think that, that shows up in research for sure. But, it seems like people are so frightened of cancer, which of course I really respect that. But why, because heart disease is so common in women, why is that not hitting the news feed?
I spend a lot of time thinking about this, and
Yeah.
really years ago wrote a blog, an article, I don't remember what it was at the time, about why. And we can go back first to the fabulous messaging around Susan G. Komen and around the American Heart Association and the Breast Cancer Association, that everyone knows what that pink ribbon means. It was such a powerful tool. And then there's the psychological, which is that women feel when they get cancer, they're victims. And when they get heart disease, it's their fault. And that psychological change is really interesting. But when you go back to how heart disease in women has really presented in the world, research did not start with women's hearts until 1993. And so until 1993, it was a man's disease. It takes about 20 years for research to catch up to mainstream. And that's about where we're at. This tipping point of taking the research and bringing it out into the world. The next problem is that women's hearts were not part of the curriculum in medical school. We all learned it was a man's disease. So until you change the education, you don't change how doctors think. So now we have a research problem, we have a doctor's problem, and then we get to the woman's problem, which I started off with, that women never believed it was their problem. And when they started to understand it, if I only ate better, if I only exercised more, if I only did more, I wouldn't have this disease. So this can't be my fault. And the narrative has to change.
Well, one of the things that's so striking, and I've learned this speaking to you before about cardiac health and to Alyssa about women's health, is it's not one thing. It's multi-system. It's
Right.
it's conscious. It is a number of different factors intersecting. It's not just psychological, but there is some element of it. It's not just physiological, but that's obviously critical. It's not just contextual. It's not just your weight or your self-esteem. It's all these things. And one of the challenges I think we've had in general in looking at women's health and then translating it into a commercial business is that's really complex. It's much easier to have a problem, give someone a pill, and we lower their cholesterol. So with all this background, and both of you have very similar minds in terms of how you take what necessitates a much more holistic approach. How have you translated that frustration and that experience and that building programs in 3 different hospitals to create Adesso? Tell us what it is and what you hope to accomplish with it.
I wanted to create something that was tangible. I wanted to make the heart tangible. When it comes to breast cancer, you get a mammogram, you know the deal. How do you figure that out with heart disease? And so I left the hospital. It was January of 2020. And you know what happened 2 months later. COVID hit. Well, I had to be grounded for a minute. And it was the first time in 20 years I was grounded and was able to really take everything I had done and put it into an algorithm that could make every component of what could lead to heart disease, the risks behind it, the psychosocial risk, the risk of vascular endothelial stiffness, the risk of cholesterol and inflammation and genetics and not sleeping and all the different things, and put it into a 3-dimensional algorithm. Well, the only thing that can actually take a 3-dimensional concept and make it linear is technology. And I was focused on taking that knowledge and putting it on a technology platform. And by the time 2 months later, I went back to see patients masked and gowned and gloved in New York City when everything was boarded and scary. I was ready to say, there is a solution for this. And I got it copyrighted by the Library of Congress, and took that IP and started a trajectory of recruiting brains and talent to help me actually launch the company. And we did.
I am such a fan of this because it makes cardiac health is a little intimidating for us gynecologists, I would say. And maybe obstetrics is a little bit intimidating for you cardiologists, I don't know. But I took the quiz and it was fascinating because it really brought, like you said, a real tangibility to cardiac health. For my patients and even for myself, I wondered why hormone therapy or hormone status was not part of the algorithm, or is it if you get more into the weeds?
I think you took our welcome to the Adesso quiz and not the I'm in Adesso.
Okay.
Because when you get in, it not only asks you about your hormones, but it asks you when you stop menstruating. We talk about early menopause. We talk about premature menopause. We talk about adverse outcomes of pregnancy, miscarriages. I mean, we do a deep dive on it, not only for us to understand risk, but for women to say, oh my goodness, this matters. This makes a difference. So the Adesso Heart Score, which is really the game changer. It's a 35 questions, 7 sections, and it's a score that not only gives the primary care provider and the gynecologist information, but it empowers that woman to understand who she is.
Yeah.
And understand some things she can change, some things she can't. but she has to know the whole big story before she even knows who she is in the trajectory of life.
I so appreciate that. I can't tell you how many patients come in to me and just say, I want hormones because they will protect my heart without any other information being added to that conversation. It's a really tough one to answer. So thank you for that.
You know, I appreciate you saying that. When I started the journey, by the way, it has been a journey being a founder and CEO of a company, because it's taking ourselves and putting everything we know into a business that we're not as competent in. No matter what, you spend a career as a cardiologist, I feel like I've got this. And now all of a sudden you're speaking to people, and I spoke to gynecologists in the beginning, like, all you have to do is, and they would say, we're not dealing with the heart. It's too much, it's too scary. And so learning from the, let's say, client side, what the needs were, became one of the most interesting parts of this journey. I started talking to gynecologists and OBs and said, you guys are the ones that are seeing women.
Yeah.
You're the ones on the ground floor. What do you need from me to make this something that you would adopt? And it took a little bit of time for me to really understand mentally where the OBGYNs were sitting in order to say, I've got it. I can figure this out for you.
Yeah.
And so what we iterated to do was really create a score for the gynecologist to say, you're at low risk, keep doing you. And you're at moderate or high risk or ultra high risk, that, you know what, maybe we've got to check you out before we start hormones. Or maybe there's more that you need to do from a clinical perspective. And let's have you see your primary care provider.
So here's today's hot flash. Did you know that cardiovascular disease is actually the killer of 1 in 3 women worldwide? 80% of heart disease is preventable, and 194 billion is spent yearly to treat women's heart disease.
So, Dr. Steinbaum, I love all these conversations and how important this is. And ultimately, to make it a business, someone has to pay for value that you're creating. And one of the things that I learned early on, when I first met you, is the statistic that I hopefully quote accurately, is every time a woman goes to the ER for what she mistakenly thinks is a heart attack, it costs the system, whoever that might be, her insurer, her employer, whoever it might be, $18,000. So there's a huge, one, is that right? And two, talk a little bit more about the huge economic benefit to, the healthcare system, to not only diagnosing more accurately, but diagnosing earlier. We started with this idea of you treating disease versus preventing. And I've known both of you long enough to know that both of you would love us to be keeping people well as opposed to treating illness. So how does this translate into adding value that people will invest in to help you build the business, and that employers and insurers will buy because they see not only the outcomes benefit, but the economic benefit?
So let's talk about a typical woman going through perimenopause and menopause. When this happens, I mean, so many things happen, but the fundamental problem begins with the arteries becoming stiff. And when the arteries become stiff, they can't dilate and fill with blood. And when they fill with blood, what they're actually doing is carrying oxygen. So if they don't fill with blood and carry enough oxygen, we tend to get symptoms when we start exercising. Some of that is shortness of breath. Sometimes it's palpitations. Sometimes it might be a little chest discomfort. And at some point it gets annoying enough, and a woman says, wait, I heard or I read this maybe could be my heart, and now I'm feeling it, and they'll go to the emergency room. The second most common diagnosis for women to go to the emergency room is unspecified chest pain. It's not really, I don't think it's a heart attack, but something's going on. And Alyssa, I'm sure you hear that in your patients all the time.
Absolutely. Absolutely. The palpitations alone,
The
which
palpitations
often
alone. Yeah. And that's a
accompany hot
hormonal.
flashes. Yeah, they're very scary.
They are very scary. And so here's the typical pattern. They'll go to their primary, they'll get an EKG done, they'll get blood work. Maybe they'll get an echo, maybe not, but they're told they're fine. And so the next time it happens, it's scary enough. They go to the emergency room, and here we go. We're in the system. The common tools, diagnostic tools used, doesn't actually pick up endothelial dysfunction, microvascular disease, which happens more common in women of this age. It's the smaller arteries, not the big ones. And all the testing we have focuses on these big arteries. So there's nuclear stress testing, and there's echocardiograms, and there's EKGs, and then there's all these blood testing looking for heart attack. And then we can even have an invasive angiogram. But unless it's done very specifically looking for diffuse disease, you might get all these tests and told you're fine. Well, at the end of the day, you're not. But the way that we look at it and the way that we look for disease is looking for disease in these big arteries, and they might look normal. And so you're sent home. The testing that I use looks for endothelial dysfunction and microvascular disease using a cardiopulmonary exercise test. And we can actually see if those arteries dilate. And if they don't, you have a diagnosis. The most exciting thing is using an exercise prescription based on what we call your anaerobic threshold, incorporating some medications to get all those biomarkers and metrics under control. You actually can get better. And so instead of $18,000+ for an ER visit, our sort of cost is about $2,600. So the ROI is so obvious, but it actually begins with those 35 questions. Because if you're not at risk at all, but you're menopausal and having palpitations, hey, maybe this is something we can look at in a really simple way to figure out if it's your microvasculature, or if in fact you might need magnesium, which is oftentimes a really simple way to treat palpitations.
Can you speak to the coronary calcium score, which of course has become much more popular, even in the gynecology field, to order, especially in preparation for hormone therapy?
I can. And it's funny, when I started talking about it was 20 years ago, and it was considered new, experimental, and not worth it. And now we are here today and everyone's using it. And I'm afraid to say we're already at the next generation, and it's not considered mainstream and standard of care. So let's talk about it. And I don't want to make people feel like, oh, I shouldn't use it at all, but it's not quite enough. Calcium score looks for calcified plaque in the arteries. When plaque begins, it's very, very soft. So you can't see it through a calcium score. And as plaque matures, it develops a calcified cap on the top of it. When you do a calcium score, it looks for calcium in the arteries. The only reason there's calcium in the arteries is if a plaque matured and developed a calcified cap. So a calcium score can give us some understanding whether or not you have plaque in the arteries. But if the score is 0, it doesn't tell you anything, really, because it doesn't tell you about the soft plaque that hasn't quite matured yet. So if someone has a score of 100, it's considered significant. But we don't actually know that when that that soft plaque calcifies, if that score might be higher. The most important thing to understand, which is really hard for even cardiologists to understand, calcium and calcified plaque is not bad. It's stable. But what it tells us is there's probably soft plaque behind it that is unstable, and that we need to really treat people aggressively. So it's not that I don't believe in it, but I know if somebody has risk I want to know if there's soft plaque. And there's CAT scan angiograms with AI that can really tell us now if there's soft plaque.
You had mentioned something early on, which is really fundamental to how we create change in the delivery of medical care. And I know that Alyssa has talked about this and has gone on to get more educated and more certifications to fill in what medical school doesn't provide. But, you don't learn about cardiac care for women in med school. You don't learn about menopause. You don't learn about, that much about nutrition. You don't learn that much about arousal, desire, and satisfaction. How do you, as physicians who have both of you have been practicing for a long time, what do you do to change the paradigm? So people can't diagnose things that they don't even know to look for. And so they need to learn what to look for. And that involves going back to the very beginning when we're making these doctors, when we're educating young doctors. How do you, in your respective fields, how do you have an impact there? Because clearly, when a bunch of people, a bunch of medical professionals and a bunch of women focused on women's health start talking, things change. We see that going on right now. We're seeing an amazing amount of change right now. How do you go back and affect the conversation before it seeps its way into the medical community with misinformation?
I think that's the ultimate question. And how do we do that? Not only, I mentioned the three things from the beginning, the research, the doctor, and the women. And so how do you impact all of it? Well, the White House initiative and all the work that you've been involved with, Rachel, I think the research is changing so that that one prong is getting addressed. Then we go back to the doctors. I hate to say it, the doctors are the hardest nut to crack, because even when I have spoken to cardiologists all these years, they'll say, we take excellent care of our women patients. And, everyone wants to be doing the right thing. And information, and especially now with technology, it's changing so quickly that as a physician, it's really hard to catch up. So that's why there's such thing as specialties. I can possibly know what Alyssa knows because there's too much to know. And that's why we all have specialties. But as the research changes, the doctors will catch up eventually. But the last problem, the women. Now, this has been what I have believed throughout the years as being the sweet spot. You mentioned a little bit about my career in the beginning. I wrote books, television, speaking all over the country. I believe there would have been a tipping point that women would have said, we demand this. Well, until the information in the medical community or in the research community spills over enough. Alyssa, I'll never forget being in the room with a group of women who heard mammograms were going to be pushed until they were 50 or 55 at the time the guidelines were changing. And the women in that room said, we won't stand for it. Well, part of my mission and hope with Adesso is that women learn about this simple, easy testing that they can get in their primary care provider's office. And they say, this is it. This is all it takes. We demand this. And so how do you do that? And this is when I decided to become a businesswoman. It's not from the bottom up. It's not going to happen going to every woman across the United States. I tried it, trust me, traveled for years. It's not going to happen. But if you go to the business, the people in charge, the insurance companies, the hospital systems, the people that are driving our healthcare system, and you show the return on investments, the improvement in outcomes, really meeting those metrics, all of a sudden the culture will start changing. The insurance companies will say, hey, go get Adesso, go find Adesso, here's an Adesso provider. And then it spreads. And for me and my mission, and poor Rachel, she has heard me complain, how come it's not happening faster? How come I can't get this out there? Because it's business. And in business, they don't see the urgency in saving lives like we do when we're doing our jobs. They're looking at the dollars and cents. And like a research study, it takes creating a really clinical research protocol to compare, to show this is what happens when someone goes through Adesso versus when they don't. And not only showing the outcomes, which we would publish in our research journals, but showing the financial return, which is really what they care about. And once that happens, I'm confident that we will be able to change the paradigm.
I couldn't have said it better myself. So thank you so much. Two things that I think our audience would love to hear. First, how do you possibly manage all of this where you're seeing patients and being a businesswoman and, living your life? But number two, how can we all find out more about Adesso and get involved?
I want all women to know very clearly, there is absolutely no such thing as balance. If anyone tells you, oh, I just do it, that is a lie. We, I think as women, we expect a lot from ourselves, and we push as hard as we can. I think the thing, and I'm sure you feel the same way, when you're passionate and when you have a purpose, you figure it out. There are some days that are not great and some weeks I'm not great. But with a little self-grace, knowing tomorrow it'll be a better day when I can balance all of it. When I'm with patients, I am 150% focused on patients. I am very humbled by taking care of human beings' lives, and they deserve my 150% attention. And so when I'm with patients, I have a team around me that most of the time catches the ball when I need to do that. This week I get to be a CEO, and so I get to hang out with you and talk about the business. And so I really compartmentalize my time so I can be really focused on what I need to be focused on when I'm in that moment. And that is my advice to everyone. Be present, be mindful, be where you're supposed to be and in it 150% in that moment. And that's the best way to handle it.
Amazing. We are going to point our listeners in the Adesso direction. I think this is fascinating and super valuable. Thank you so much.
I would love to share. Adesso.health is our website, and my Adesso on Instagram and on LinkedIn. And join us, because what we really want to do is help spread the word. And on my Adesso on Instagram, come on board. We're just starting to have the conversation. But go on Adesso.health, because it really provides not only information about Adesso, but we have amazing advisors to give advice about life, about what it means to be successful in our own lives as mothers, businesswomen, wives, daughters, sisters, how to dress, how to love, how to live, how to be vital. It's all there. And I'm just hoping that women, I always say, tell 4 friends. We talk a lot. Just tell 4 friends, and let's spread the word.
Thank you so much. It's been an absolute pleasure.
Thank you for having me.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.